Fine. So the last topic in respiratory system is very important topic. Another short question. Short question. Okay. Cystic fibrosis, very important. Okay. Cystic fibrosis. Okay. Fine. What is cystic fibrosis? There is a problem in the CFTR gene. CFTR is a gene which is going for mutation. What is the role of the CFTR gene? The first image is the normal thing that happens. What happens normally in CFTR? Yes, CFTR is a gene which is expressed, which helps in chloride transport. See, chloride is excreted into the secretions. When chloride is excreted into the secretions will be thin. Okay, so chloride makes up the secretions. It is watery and thin. This will help in mucus clearance. This is protective. Okay, now my chloride channel is not working. There is a mutation in CFTR. My chloride channel is not working. What will happen? Chloride cannot be excreted. So there is no chloride in the secretion. So what happens to my secretion? My secretion becomes thick. When my secretions becomes thick, it cannot do its job properly. Where all it will happen? Everywhere. Respiratory mucosa, thick secretions. Mucus is very thick. Mucus clearance is not taking place. Recurrent infection. Pancreatic duct. Pancreatic secretions are very thick. It cannot go through the duct. What will happen? You will not have pancreatic secretion in the intestine. Without pancreatic secretion, you are not going to have absorption. So it will result in malabsorption. Your feces, your stool will become very hard. It can result in meconium ileus. It can result in constipation. Clear? So because of this CFTR mutation, chloride transport is affected. You will have problem in so many parts of the body. That is called as cystic fibrosis. Okay? Cystic fibrosis. Simple. Remember this film, Hi Nana. Hi Nana, what does the baby have? The baby always had this oxygen tube with no. So that was because the baby had cystic fibrosis. In the final scene also they were trying for lung transplant and all, right. So the problem is in the lung. It's also in the absorption. Okay, fine. Inheritance. What is the mode of inheritance? Autosomal recessive. Autosomal recessive is the mode of inheritance. Very good. Channel affected? Chloride channel. Gene mutation? CFTR gene mutation. Most common gene mutation was the question asked. Okay. Phenylalanine deletion at 508. Deletion 508 at phenylalanine residue. Deletion 508 of phenylalanine. Clinical features, system wise we will go. Respiratory system. Earliest feature is bronchiolitis. Okay. Bronchiolitis, then bronchiectasis can happen. Recurrent infections because of this thick mucus. Recurrent infections. That is respiratory system. GIT, malabsorption because of pancreatic insufficiency. In the newborn period, meconium ileus. Obstruction because of meconium ileus. And there is something called as DIOS, distal intestinal obstruction syndrome. It can also cause liver cirrhosis and biliary cirrhosis because of bile being not excreted in the liver. It can cause biliary cirrhosis because of pancreatic malabsorption and because of this malabsorption. Okay, that is GIT. Now, what about in males? Males, it can cause azoospermia. Another MCQ asked in INI-CET, azoospermia, because of congenital absence of vas deferens. Okay, congenital absence of vas deferens. Okay, sweat glands, what happens? Sweat glands, what happens? Take home point, what happens in sweat glands? What happens to the chloride content in sweat glands? Why? Why increased? Everywhere I told the problem is with chloride secretion. So there is no chloride, that is why your secretions are thick. But you are telling me in sweat it is increased. Why? Decreased. Increased is right only. What you have told is right. But tell me why. Because the action of CFTR in a sweat gland is opposite to this. The action is absorption of chloride. When that is not working, sweat has increased chloride. Clear? In all other glands, chloride transport is affected. Chloride cannot go out. Sweat gland alone, chloride cannot be absorbed. That is why chloride content in the sweat is increased. Very good. This is because INI-CET question has been asked. Very important point. Yes. That is why it is increased. So please write chloride content is increased. So you will have salty sweat. Salty sweat, frosting. Okay. So questions will be given. The mother kisses the child. She feels that the sweat is salty. The mother sees frosting over the skin. Okay, all these are clues for cystic fibrosis. Okay, that is because of increased chloride. Okay, so I work as an assistant professor in a medical college, right? So there we have JRs, junior residents, just like you people. They have completed MBBS, they have joined for job, and they will study as well as work. So last NEET-PG, when I was just there was one fellow. He told me, ma'am, tomorrow is my NEET-PG exam. You have to teach me one topic. That topic should definitely come. So I told definite question will come from cystic fibrosis, and I taught him everything. Everything I taught him about the most common mutation, this azoospermia, sweat chloride test, everything, and the next important aspects like treatment, the drugs, everything, top to bottom I told, and I told him definite question will come. Next day he came and told me, ma'am, whatever you told, cystic fibrosis came. I was very happy. Okay, fine, cystic fibrosis has come. And I asked him, did you answer it correctly? I don't know whether I answered it correctly. You didn't teach me that point. So I just asked, what was the question? I taught you everything about cystic fibrosis. Why couldn't you answer that? And what he told was, the question was, the mother kissed the child. The sweat was salty. Which channel is affected in this condition? Options were potassium, chloride, sodium, and one more. Very straightforward question. You know cystic fibrosis, you should have selected chloride. But what that fellow did, he selected sodium. Why? Because at that time what happened? His brain started overworking. Okay, salty sweat. When the sweat is salty, salt, sodium. So sodium channel is affected. So this is what we do during our exams. Overthinking sometimes. Unnecessarily we overthink and we just forget what we already know and get it wrong. Okay, so please remember, don't confuse. Don't be like that fellow. Salty sweat because chloride is increased. Wherever chloride goes, sodium will also go. That is why it is salty. Okay, fine. Yes. Recurrent respiratory infections, you already know what are the organisms. Please write those organisms. Pseudomonas, Staphylococcus, Burkholderia. Screening test, sweat chloride. That is why we measure the chloride content in sweat. It will be more than 60 milliequivalents per liter. Okay, sweat chloride test. In newborns, you cannot do sweat chloride test. In newborns, there is another test which is used in screening. Can anyone tell me what is that? Newborn screening. What is the name of the test? In newborn screening test? No. NPD can be used as another test, but screening is called as immunoreactive trypsinogen. It is a blood test. Immunoreactive trypsinogen. Immunoreactive trypsinogen. Okay, yeah, the card is dried blood spot. You take the dried blood spot and send for the screening. That is called as immunoreactive trypsinogen. Okay. Yes, go to the next page. Criteria. Features, lab evidence. So features, when you see, any one from this side should be there for diagnosis, and only one from this side should be there. Out of the three, I am going to say any one from this side and any one from that side should be there. In features, clinical features as mentioned above. At least 2 clinical features as mentioned above. Family history positive. Family history positive. Positive newborn screening. Among this, one should be there. Among this, one should be there. Lab evidence. 2 sweat chloride positive. 2 times it should be positive. CFTR gene mutation positive. Or abnormal nasal potential difference. This is diagnosis. Okay. Either clinical feature or family history or positive newborn screen. Any one. 2 sweat chloride or CFTR mutation or abnormal nasal potential difference. Any one. Okay. This plus this. Any one from this side and anyone from that side is the criteria for diagnosis. Treatment is what are the names? CFTR modulators. Another MCQ question. What is the name of those modulators? Very good. Cafters, the cafters. Eva caftor, Tisa caftor, Luma caftor. Okay. These are the cafters. Please don't forget cafters, CFTR. That's all. This is about cystic fibrosis. Okay. Take home point in cystic fibrosis. Please remember all secretions, your chloride level is reduced. Sweat alone, chloride level is increased. Okay. One point if you remember in the whole class, that is enough. Chloride channel and not sodium channel. Phenylalanine deletion is common. Okay. Yes. Fine. So, you have come to the end of RS. I told you, right? Very short topic. Okay. So, everything is important in this foreign body, pneumonia, and this cystic fibrosis. These three are very, very important. Okay. Yes. Yes. Fine. Okay. So, can we go to some questions? Simple questions. Yes. Child comes